Hello, everybody, and thanks for joining us again for another podcast in our Reducing Venous Depletion series. I'd like to thank everybody again for joining us, and hopefully looking forward to a great conversation today. Today I have Tara Daly, Nicole Hoder, and Connie Giorgenti on the phone with us. Tara Daly is coming to us from the Chicago area, where she works in a NICU for a large hospital system as a NICU nurse and vascular access specialist. Then I have Nicole Hoder. She is a sales rep for Vygon in the Chicago area. And then Connie Giorgenti, who is Vygon's national clinical educator. I'd like to welcome you all today. Thank you so much for joining us, and looking forward to hearing what you guys have to talk about. So, Connie, please take it away.
Thanks, Steve, for the introductions. And Nicole, I wanted to thank you for arranging this luncheon podcast.
Of course. Thanks for being here today.
And Tara, I want to thank you for taking time away from your family. I know that's not always easy.
Thank you.
And from one Midwest girl to another, I want to also thank you for challenging the failure rates of short peripheral IVs, as well as congratulate you for presenting for the first time at AVA.
Thank you. That was exciting.
Wasn't it? It's a great conference.
It is.
As one of our early adopters for the EPIV, can you tell us what motivated you to consider using it in some of your tiniest patients in your NICU?
Yes, at one of my classes, I was speaking with Nicole, and she mentioned this product that they had, the extended dwell, and I hadn't really heard about using it in our NICU or in the NICU. We've been looking for a product that could provide a longer access besides a central line.
Yeah.
So I was very interested in getting some more information on how we could bring it into my nursery.
Yeah, it's unfortunate sometimes because we have to stick our patients so much, and then we're left with no other choices but a pick, right?
Yes.
And then, we put our patients at risk, for the complications associated with those central lines. And sometimes all they really need is a peripheral.
Exactly.
So it's great. Is there one child, a poster child maybe, that you can tell us a little bit about?
Yeah, when we first started using it, he was one of our first babies who received one of his first extended dwells around Christmas, early Christmas present for me.
Yeah.
I actually was able to insert it on a 24-weeker. He was about 530 grams at the time.
Wow.
So for those people in the adult world, that's 1 pound, 5 ounces.
Yeah, thanks for clarifying.
Yeah. No, nobody can really appreciate or understand that being so small.
Yeah.
So this was a huge win for us. We were able to provide him with a secondary line to his PICC line that was able to provide him with blood products, antibiotics, and a lot of different medications on and off. In his 7-month stay with us, we actually were able to provide him with 7 lead extended dwell catheters, and that provided him with over 100 days of therapy.
Oh, wow.
So the most exciting part was that in his 7th month, when we tried to go get him another line, it actually was easy because we had preserved those vessels for 7 months, whereas in the past, when you try to insert on a 23-weeker, you wouldn't really have much left.
No, because on average, we're sticking them every 2 days.
Right.
And it's not always one stick. So, yeah, they do get vascularly depleted. And, that's what I'm very excited about on the extended dwell peripherals. And, that term is not necessarily accepted, but we really are seeing dwell days extend beyond the short peripheral, and that is huge in these tiny little patients, but as well as other patients too.
Oh, yeah, very exciting.
Over time, you've had this direct impact on reducing venous depletion. Can you help the leaders understand, the amount of time and effort that has been saved for these patients?
Yeah, it's and we've been using this product for about 16 months.
Over a year.
Our census on average has been lower than normal, but we've still been able to insert about 70 lines and a total dwell of over 500 days.
Oh, wow.
And with an average of 2.56 per successful IV, we have been able to save 631 pokes when I calculated it. So those numbers are sticking out in my head because it's just unbelievable to think about that.
The numbers, right?
The numbers,
right.
Yeah.
Because we do not know what we don't know, right? Like,
exactly.
There's days when we go in and we poke, and then we forget it because we get that access.
Right.
Then tomorrow we're not there, and that same baby gets poked again multiple times, and then the next day. So yeah, when you actually stop and count those numbers,
Exactly. Think about it. Right.
that really is, absolutely huge. What helped, moving forward, I guess, how will you continue? Of course, you're going to use it, for other NICU patients, but I understand it's going, you kind of had a ripple effect, right? This has gone past just you and your NICU.
Yes. So we've reached out to other sites, and they're now using this product as well in their NICUs and PICUs.
Oh, wow.
And pediatric heart units, from what I understand. And they're having great results as well. And I think we're starting to think more and more about making guidelines to make this a first choice, not a last resort.
Yeah.
And probably using it as a primary line for us in the NICU as for those babies who are over 32 weeks gestational age, and as a secondary line to their PIC line for their primary source of nutrition for those babies who are less than 30 weeks.
Yeah.
So we will definitely continue to use it. We've had great results.
Did you ever think that you would have impact beyond your unit?
No.
I mean, I think for me, knowing you, that's what's been pretty cool, is to see this evolution, right? We started with that PIC class. You saw this device and thought, I think I'll give it a try. It's not always easy because there's always barriers, right, when we want something new. Did you have barriers with it as well?
We did. At first, I had to convince our unit that it was something that we needed.
That's not
I had to go, no, that wasn't. Then I had to go to the products committee to prove to them that this was a safe and product for use in our hospital. And then we completed a trial. And I think everybody was blown away with the results that we had, including us. It was really exciting. We were like giddy little teenagers every time we put one in.
Yeah.
It was so exciting. And then it made it easier to, get what we needed for the use of those products. After that, we presented our material at AVA's conference, and then the other sites caught wind of that, and they wanted to be introduced to the product as well, and now they're using it in their unit. So it is exciting to see that we've been able to bring this to the population, and I'll continue to talk about it because I love the fact that it's saving our babies from getting poked, and they're very fragile to begin with. They're at high risk for infection.
Yeah.
They're neurosensitive.
Absolutely.
And we've been able to, on most days, insert it the same time as the PIC line. So during the same procedure, and save them from a lot of stress.
Yeah, absolutely. And, for the listeners, just to understand, you're a part of a huge system, and you're a smaller NICU in that system.
Correct.
And then now all the bigger NICUs are looking and saying, hey, wait a minute, what is Tara doing over there? So that, you really are making, a huge impact. And, Nicole, as someone who's been with Tara, through this all the way, is there anything that you want to add or commend her on?
Well, I do want to commend Tara on her perseverance with bringing the product in, first of all, for a trial, which was very successful, and then just continuing on with the product and really being an advocate for the product and being an advocate for the babies. It's just been really nice to see that she's been able to really, really reduce the number of sticks that these babies receive, and reduce her central line days. It's just really been rewarding for me to see on my end. I do have a question, Tara, if you want to let us know, what is the longest number of dwell days that you've had so far?
Our longest so far has been 31 days.
Oh, wow. Yeah. Wow.
So, and that was for that specific patient I was talking about. So our average dwell is probably, I think we're around 8 to 9 days currently, but with our longest being a dwell of 31 days.
Wow.
And we were able to provide blood products, medication, and cardiac meds at that time.
Wow.
Through that line.
That's great.
That's unbelievable. And one little peripheral IV, yeah. Is there anything you would like the listeners to know about this experience, this journey, Tara? Because, challenging the norms is never easy. We're always faced with our challenges. How do you bring products in? People who want to continue to do what they've always done because they've done it, is there any one thing that you'd like to share or have the listeners know? Or
I think I'm still meeting some challenges with some people not wanting the babies to get poked again. But because we're saving so many pokes, I'm trying to educate them. And once they really understand the numbers, then they're like, oh, okay, so I guess he does need that line. And we've been able to save, in the past, when we had to insert a peripheral IV on a baby for a blood transfusion, they would get a blood transfusion, maybe not use the line again for 2 days, and then if they needed it, they'd have to get poked again. But if we provide them with this line as a secondary line to their PICC line, then they can keep it in for 8 to 30 days, some of them, and that saves them just so many stressful moments. Absolutely. In the NICU.
And I can't imagine the stressful moments that it saves the parents.
Oh, absolutely.
Like those ones that are there and at the bedside and see this. So, yeah, you really are having a huge impact. I have to challenge you to publish some of your results. I know that is like one of those daunting tasks, but, it really is making a difference. And I think, like you said, we have to press upon people to really look at what we're saving the patients overall compared to those sticks every 2 days.
Definitely.
Yeah, amazing. Well, I want to thank you again for taking the time out. I know life is very busy and hectic, but this is important. And the fact is, you really are making an impact. And it's a pleasure to have the opportunity to watch you grow into this. It's been amazing. And Miss Nicole, I want to thank you too for arranging the lunch podcast.
Of course.
Wow, thanks, guys. That was really such a great conversation to listen to, and really such a unique thing to be a part of. Tara, I just want to thank you again for taking some time out of your day to join us and to talk about it, and really to hear the impact that you're having, not just for your patients, not just for the families, but really for your entire hospital system and what's going on there. Is really such a cool thing to hear. And you really should be commended for all of your hard work and dedication and perseverance and persistence through this whole thing. I do have to say that, that story that you tell about the 530-gram neonate is one of my favorite stories because, when you really think about what the extended dwell peripheral IV can do for patients, I feel like that captures it. That really epitomizes the benefits to it. I mean, 7 EPIVs for 7 months of therapy as secondary access for that patient. To really think about the number of needle sticks that you saved, the amount of vasculature that you preserved in that patient for if you needed it later on and when you needed it later on in his stay in your NICU. Really just, it's so hard to quantify all that. And I think you've been able to do it. But really what you've done for that patient is stuff that's not going to be able to be quantified as he grows and becomes older. So thank you so much for really sharing all of that. We do appreciate it. I do want to thank everybody for joining us on this podcast, please look for us on our next one at VygonUSA.com, ReducingVenous Depletion.com, and on our Twitter and LinkedIn accounts. Thanks so much, everybody, and have a great day.